Welcome to another episode of Influences in Dentistry. I'm Dr. Geeta Perks, and I'm excited to share the inspiring conversation with you today. Let's dive in and learn from another amazing dental professional. Welcome to Dental Focus Marketing's Influences in Dentistry podcast, and today I have Dr. Lawrence Neville. He's a recognized international aesthetic dentist. He's a Diamond Invisalign provider, and he's also a principal dentist at Spa Dental. He is a faculty member at Align Technology, directors of Clearly Aligned Network and Dental Events Australia, and he's also one of the key drivers to Engage Aligners course, which is a course series which has expanded across Australia and New Zealand, and it's helping dentists to really feel confident and capable in treating their patients with clear aligners. And since migrating from Scotland to Sydney, Lawrence has built a thriving multiple location practice, which is really blending aesthetics and patient-focused care. So I'm really excited to have a chat with you, Lawrence.
Thank you.
So you can share your story with us.
Yeah, thank you for the kind introduction. I do a lot of things. I've got a lot of different strings to my bow and a lot going on. But it's all focused around, I suppose, patient care and actually treating patients early rather than late, and it's my passion.
Yeah. Well, I'm really excited to get to know about that, but I think before we even start there, let's start from the very beginning of your journey in dentistry. And who or what influenced you to pursue dentistry?
Good question. So my dad, first and foremost, my dad was quite good at guiding me as a young boy who just wanted to play sport. He knew that I had to educate myself a little bit more, so he encouraged me to go to university, and then we looked at different sort of things that you could do at university. My sister had already gone and become a doctor. I knew that I didn't really like hospitals. I didn't really think that that was for me, working weekends and evenings. So my dad sort of presented me a few options between physio, between optometrist, between dentistry, and sort of we hit the head on dentistry with being you could be a business owner, but also a patient carer at the same time.
You knew that very early on.
Yeah, I did. It was still a leap of faith, really, to jump in. And to be honest, the first year of dental school I really didn't like. It was a lot of theory, it was a lot of studying, it was a lot of stuff that just I didn't feel was that related to dentistry. And then gradually, luckily, as the years went on and I stuck at it, I started to get more passionate and more interested about it.
Yeah. And so you graduated from Dundee in 2011?
Yep.
Yeah. And so what was that path for you after graduation? Did you go into NHS dentistry like most British dentists, or did you go straight into private?
Yeah, so basically I was very lucky with the NHS job that I got. So basically after university in most of the UK, you do a year called vocational training where they pair you up with an older dentist who can be your mentor as you go into that first year or that first leap of faith, which I think is a really tough year for a lot of graduates in Australia because they don't have that mentorship program or that sort of safeguard of someone next door that can literally come in and guide you through a difficult case or a difficult restoration and sort of not get you out of trouble, but really just hold your hand along the way in that first year, which is a massive learning year. So I was really lucky to work under a great dentist actually, who was a multi-practice owner, so a good businessman, but also really clinically quite a good dentist. And he pushed me pretty hard in my first year. In my first year out, he basically wanted me to do everything at least once while he was holding my hand. So even in my first year out, I placed an implant. Not what I recommend, essentially, but he held my hand through the process just to really push me out of my comfort zone. And going out of the comfort zone was really the massive learning focus from that experience, rather than actually the placement of the implant itself. It was really, you have to push yourself to learn and you have to go outside your comfort zone to get to the next level.
Yeah. So what was the turning point then for you? Was it because you had to do all of this stuff that you wanted to migrate to Australia?
So I come from Glasgow in Scotland, went away to university in Dundee, which is about close to 2 hours from Glasgow, came back to Glasgow thinking that's where I wanted to be, and sort of after a year of doing dentistry in Glasgow, I just sort of thought, this is going to be me for the rest of my life? Is there more out there? I've been really lucky to go on family holidays around the world when I was sort of younger, and I just wanted to go and explore a little bit more before I sort of established myself as a practitioner or possibly bought into a practice. So I promised my really good mentor after my first year that I was going to go away for a year or two and come back, buy into his multi-site practices, and unfortunately to today I've still not gone back.
No. Yeah. And why Sydney in particular?
So I flirted between Sydney and Melbourne when I first arrived in Australia, and a job basically came up in Sydney before Melbourne. I love the culture of Melbourne, I love the food, I love the coffee, I love weekends here. I'm probably in Melbourne maybe 4 times a year at least. But Sydney, the beauty of it, the beach, the harbour, and then just landing a good job first sort of kept me in Sydney.
I was going to come to that. Was it easy for you to find a job? Was it easy for you to find the next mentor?
It was. I came out quite confident to Australia because of that vocational training year, and that exposure to private patients, but also NHS patients. And one of the advantages of the NHS is there is literally patients queuing to come in for your services. So you get a lot of hand skills up really fast on the NHS, and you probably treat patients a little bit too fast on the NHS. But as a first year learning program, it was amazing. So when we came to Australia, we'd sort of done a little bit of research about Australian graduates, how much experience they have in learning, and as soon as we started interviewing for jobs in Australia, we got questions sort of along the lines of how many crowns have you done, how many extractions have you done, and we were answering 50 or 100. The people that were interviewing us were blown away because Australian graduates coming out were saying 5 or 10 at the most. So I think that UK NHS learning experience really propelled us. Instead of being a second year graduate, we were almost like 4 or 5 years sort of graduated at that point in time. But there was still stuff that even though we had the hand skills, we still maybe didn't have the diagnostic and the treatment planning skills that you can't skip ahead. You've just got to do the time to be able to get to that level of good diagnostics and good treatment planning.
And in terms of your career pathway, you've gone into aesthetics and you've gone into Invisalign, and how crucial was that, do you think, having a mentor do you feel that guided you in some way going into that? Definitely. That
so
pathway?
I had some spare time when I was in Australia at first, when I first started with my job, and I went round all the different sort of specialties to like hang out with them for a day and try and watch what they were doing. And I was just really lucky. I came across a big Invisalign orthodontist, Maurice Rappaport, and still to this day we speak about some cases, and I'm very thankful that he then took me on into his practice to work kind of like as a hygienist or an oral health therapist for him, or an orthodontic therapist. And from there I really learned, it propelled again my orthodontic learning, particularly using Invisalign as a system.
Yeah, because you've now built your reputation as a Diamond Invisalign provider, and so was that something that you always aspired to being, or was it just an opportunity that just unfolded?
I think a little bit of both. I think the opportunity unfolded. I think working for Maurice, I realised that patients wanted Invisalign, and you got amazing outcomes for patients and made people happy, and that was slightly different to general dentistry doing fillings and crowns that maybe people didn't necessarily want but they needed. And at the end of the day, if you do good treatment, the patient is happy, but the orthodontic part and the Invisalign part was different. And then I also looked at it from a lifestyle perspective, and I noticed that doing Invisalign actually freed up more time rather than tying you down to sort of chair time. So then when I did start my own practice, it was an easy decision that the whole practice was going to be based around Invisalign first, and then all secondary treatments would come off the back of Invisalign, hopefully.
And coming on to practice ownership, because you now run a multiple practice location, and it's thriving, and I've seen it from conception to now your multiple practices. Was it that you always wanted to be a principal?
I think so. So my dad's always had his own business. My dad was an accountant and had a sort of medium-sized accountancy firm. And I don't know, I think there must just be something in it that I've always kind of been entrepreneurial, or I've always wanted to be my own boss. I probably put it down to that I'm actually a terrible associate because I like being my own boss so much, so it's probably that I had to be my own boss. But the business aspect really interests me as well as the clinical aspect, and I think I quite like putting on different hats on different days and at different times, and going between hopefully being a good clinician to then being a good boss to work for, and then having a thriving practice that you can give people opportunities in.
Yeah. And what would you say is one of the biggest challenges that you've faced as being a principal?
I think since COVID, I think HR has definitely been hard, and I think that HR has different challenges. Coming out of COVID, we had a lack of just general workers, I think, in Australia. I think it's quite difficult, the landscape in Australia, because dental assistants, there's not a great training or registered pathway, and still to this day they're not registered in Australia, which is unlike the UK where they have to be sort of registered. So I think that is hard, and there's lots of aspects to the HR part of it that are hard, especially as your staff grow and especially as you start to get bigger and bigger teams. And I think part of that is down to time and training, and part of that is actually having a specialist within the practice who knows HR training, onboarding, and doing that better and better.
Yeah.
Dental Focus Marketing's Influencing Dentistry podcast is today sponsored by Boutique Whitening. Most practice owners already know teeth whitening works, but what catches many out is how inconsistent it becomes when it only happens if a patient asks. Hi, I'm Stephen Douglas, and I work with dental practices to look at how teeth whitening actually fits into everyday dentistry. Not the gel, not the price, but the system around it. I run short online teeth whitening audits and reviews for practice owners. It's about 20 minutes, clear, clinical. So if teeth whitening feels a bit hit and miss in your practice, this will show you why. You can book your audit at audit.boutiquewhitening.com.au.
And from a business perspective, if you had any advice to dentists who are thinking of building a practice, what would that be?
So I think my biggest piece of advice to any dentist thinking of starting a practice is do not overspend. Try to start small, so start with enough space. But nowadays, if you buy a really good dental chair, if you buy a scanner, if you buy an OPG or a CBCT X-ray machine, all these little tools that you can buy, all these new technologies are fantastic, they're amazing, but by the time you add all of the technologies together, you've spent a lot of money, and that then puts yourself under a lot of pressure to be able to pay the bills every single month. So it would be really start small, build up, and as you start to make profit or become profitable, then add in as much of these new technologies as possible. Put the money back into the business, but don't start with this big outlay of $1 million or $2 million, which I see a lot of
There's
practices.
There's a lot of people who do that.
And then they get put under this financial stress and burden, and then it usually leads to poorer clinical outcomes, either because they're stressed and they can't concentrate on the treatment that's been done, or they're pushed to take on cases that maybe are not appropriate or a little bit more difficult because they're thinking about that monthly repayments that they've got to do.
Right, that's a great tip. You are a speaker for Align Technology, and you're also an educator for Engage Aligners. And what inspired you to become an educator, a speaker, and a mentor?
So I think along the way I've been really lucky to have amazing mentors for myself. So whether it was in university, where I've still got two really close relationships with mentors that were there. One of them, John Gibson, was an amazing speaker that just capsulated the audience when he was talking, but also really good at giving sound advice about ethical dentistry and ethics, dual qualified dentist and doctor. So I give him a big shout out because he shaped that in the inception. And then luckily, since coming out of university, the principal that I worked under in Glasgow, Morris, that I worked under for orthodontics, and then just lots of other mentors along the way. They've been really kind at like being open and sharing their philosophies, sharing how they do stuff. And I just think that there's enough for everyone out there in dentistry, and we're not in competition with each other. So I just want to be able to give back, and I think it's an honour to be able to teach someone, and then it's a real sort of pleasure to see someone take what you've taught them, put it into practice, and then have success with it as well. And ultimately the whole thing revolves around doing the best for the patient and actually giving patient best treatment outcomes that we can possibly do. And I think if we don't educate the young dentists coming out or the dentists that have been out for a long time some new techniques and new technologies, then the patient loses out ultimately.
Yeah, they do. So tell us a little bit about, especially for the dentists who are listening, a little bit about Engage Aligners and how did it come about? How did you get involved in it?
So I was very lucky that Align, in the first speaking gig that they invited me to speak at, which was in Cairns about 2 or 3 years ago, I bumped into Jack Milgate and Rohit, who were both Invisalign speakers. At the time, we sort of watched each other speak and we thought, I do that too. We've got a lot of synergy together of what we do. We had a beer together. We realised that outside of work we're into a lot of the same sort of things as well. And we sort of came up with this concept that we think that general dentists should really all be able to align teeth to some degree. Not to say that general dentists shouldn't still refer to orthodontists, and definitely there's cases that general dentists really shouldn't do, but this concept of sort of pre-restorative treatment to make a better restorative outcome and reduce the burden that we place on patients in cases where if we don't align them we have to drill the teeth down more, or we have to use more crowns rather than onlays or rather than veneers, etc, etc. So we came up with this sort of ortho-restorative 2-day course, which we teach people how to align teeth to get them into the best position for occlusion, to reduce tooth wear, and a lot about finding out about tooth wear and how to talk to patients about it, and then finishing off the case with really good restorative treatment, whether that be whitening, composite bonding, or veneers.
Yeah, that's amazing, and I guess also because a lot of these clear aligner brands don't actually teach this, so that's something that a lot of dentists are looking for. What do you think is the biggest barrier for dentists in terms of their confidence in treating their patients with clear aligners?
I think there's two aspects to it. I think there's an aspect to it where dentists underdiagnose quite a lot of the time and don't identify cases that are in their treatment rooms, particularly in recalls and hygiene rooms, and that's around the area of tooth wear and abnormal tooth wear, which I think is becoming more prevalent nowadays. So the easy thing about that is it's internal marketing. You don't really need a massive marketing ad spend for that. You can find some cases to get started for within your practice. Off the back of that, you then get maybe more referrals, and it starts to build and it starts to build. You add in some external marketing and you add and you build again. So I think that's sort of number one, a little bit of a fundamental, maybe why dentists don't get started, because they can't find the right cases.
Yeah.
And then the second part of it, which we see and Engage a lot, is as soon as we start talking, people say, the ClinCheck, I don't know if it's realistic or if it's unrealistic. And that part we can teach them quite well, how to make the ClinCheck predictable, and the predictability part can come from sort of a few different areas. And then the third part is, I suppose, having the confidence to, well, what if the first round doesn't go to plan? Is it me? Is it my patient that's not wearing it? How do I be able to tell what's going on?
Yeah. And in terms of the role of Invisalign and cosmetic dentistry, what do you think that's going to be in the next decade, and what sort of skills do you think dentists need to have and to develop in the near future?
Yeah, well, I think Instagram, TikTok, social media, the pressures on young people to have nice, straight, white teeth is higher than ever before, and unfortunately, particularly in the UK, more than Australia at the moment, we're seeing the prevalence of people going overseas to get very quick treatments. We're seeing people even in the UK or Australia having the quick fix or the quick treatment, and that tends to be more biological cost. It tends to more tooth sacrifice, more enamel sacrifice, and the problem is if they're having that in their teens or in their 20s or even in their early 30s, the restorative burden to look after that for the rest of their life and replace it, people are not being told about that, and they're not being told the cost of that. So I think the role of Invisalign and clear aligners in that process is that we have to be pushing patients to do the treatment and we have to be pushing patients and educating them about why it's so important. And I think some of the Invisalign tools that we now have with Smile Architect, to be able to show a patient, if we don't straighten your teeth, you're going to lose 35% more of your tooth by doing the veneers or making them look good, where if you just give me 8, 12, 16 weeks of straightening, I can reduce that down to 10%, less restorative burden, less removing tooth. And sometimes when you get to the end of the straightening, they're not interested in doing the veneers anymore. That's the best case scenario. And I think it's about giving the patient the option that they maybe don't need to go through a full set of braces to fix everything. They maybe don't need to go through 12 to 18 months of clear aligners to fix everything. But if you just give us 12 weeks, we can do a lot more than if you just go and see someone and have full veneers, crowns, whatever placed on your teeth. So there's a little bit of a compromise there, where we still have to offer the specialist orthodontist and fixing everything, and that might work for some people and they might be open to that. But is there an alternative between that and between having the veneers and losing tooth structure? Tissue. And I think there's this nice little bit in the middle which is really appropriate for GPs to be able to do.
Speaking internationally, what would you say is your biggest, standpoint, anything that really stands out for you that you've learned from them with meeting so many dentists internationally?
I would say that the biggest gig that I've sort of had internationally was in Dubai, where Invisalign invited the top 150 doctors all to be in the same room. So being in that room and speaking in that room was a nervous moment, and I don't get nervous very much when I'm speaking, but it was really like I had a bit of imposter syndrome. I thought, why am I in this room? Why am I speaking in this room? Am I good enough to be there? And actually what you learn is that all dentists kind of have the same problems. All dentists go through the same emotions of imposter syndrome sometimes, am I good enough sometimes. All dentists make failures. And in that room there was people that maybe did really high volume, but maybe they're not the most amazing orthodontist or the amazing clinician. And then you had clinicians that did smaller amounts but absolutely amazing cases. So there's a bit of a variation in degree. But the main thing that I sort of learned throughout that whole process is just don't compare yourself to anyone else. Really just focus on your patients, the right sort of treatment, the right care. And most of it is actually the most successful older dentists that I've ever spoken to. It's about a lifetime patient, and it's about looking after patients for life, and they're the people that actually have the most successful practices.
That's great advice. I guess my next question would be, because you travel a lot, what's the one thing that you always pack?
Oh, that's a good question. You're throwing me out there. What was the one thing that I always pack? I always, because I don't drink enough water, so I always pack hydration tablets.
Okay, I wouldn't have thought that.
It's a bit boring, but that's one thing I always pack.
And your best dental gadget you could never do without?
I'm going to sound biased because I speak for a line here, but genuinely the iTero scanner is the thing
I thought you'd say that.
Yeah, I couldn't explain to patients what is going on in their mouth if I didn't have the scanner. And I think even from a point of view of picking up like a camera and taking a photo, the scanner is just more than 2D, it's 3D, and there's so many tools within the scanner that you can really explain to patients, and it's so much better to tell them and show them and sort of guide them where they become the author of their own treatment plan, because they can see it and they point stuff out to you rather than you pointing it out to them. It's just, it revolutionises it.
It's great, isn't it?
We had a conversation briefly this morning about students and them not having scanners in universities.
Incredible.
It is beyond me now that the universities don't have scanners. If you think of something as simple as a crown prep, and the feedback you get from the scanner when you blow it up and you look at it and you think, God, I need to do better, I need to smooth that margin, I need to take a little bit more away there. For a student to learn off of that, it's just like a whole other experience rather than trying to look at it on a tiny model. So for me, the universities just we have to as a profession push the universities to do better with having the technology that's available.
And having the budgets for it, really.
Having the budgets for it as well,
And if you weren't a dentist, what career would you love to do for a day?
I think anything to do with sport. So I'd love to be a sports coach. I would love to, if I wasn't teaching people parts of dentistry, I would love to teach them some sports. Not sure I'm good enough, but I would love to teach them. So a sports coach.
Sports coach, okay. What are you most excited about in the year ahead?
I'm really excited that we've made with Engage, we've taken it sort of as far as we think we can take it over the past 2 years, and we've now partnered with Clearly Aligned and Clearly Select. So we're now bringing another education platform to Australia. There's an online component to it, and there's an in-person component to it, and then there's a community component to it. And the community component is actually the bit that excites me the most, because it kind of connects dentists from being in your own surgery a bit isolated to actually being able to share and post and sort of have a bit more mentorship whenever you need it from this sort of community of like-minded dentists, all based around sort of ortho-restorative treatment.
Amazing. Cool. I think if anyone really wanted to know a bit more about Engage Aligners, well, how do they find out more about it?
So you can direct message me, so you can find me on Instagram. Just if you type in Dr Lawrence Neville, hopefully it'll come up. Otherwise, if you type in Engage Clear Aligner course into Google, it should come up as one of the first links as well. And that's the same for Clearly Aligned and Clearly Select. There's websites, and you can again just go and fill in one of the little boxes, and then we can send you some information or give you a call.
That's great, and we'll put that in our show notes as well.
Perfect, thank you.
Yeah, and we'll also put it out in our newsletters as well, so that's great.
Thank you so much.
But I wanted to say thank you, Lawrence, because I really feel that your journey from Scotland all the way to Sydney and everything that you've achieved, whether it's Invisalign, aesthetics, being a speaker, practice ownership, I think it's truly inspiring.
Thank you.
And I think that our listeners will find your story inspiring as well.
And to cap that off, I really believe that I'm not special. I genuinely believe that everything that I do in practice, anyone else can do. They just put the systems, protocols into place, and we're happy to share them, as you said, on the courses and stuff like that as well. So but thank you for having me on. I appreciate it as well.
Yeah,
and for all your support over the years as well, which we didn't touch on it in the story. But initially when we opened the practice, which I think is a good point to touch on, I got a lot of external marketing support from you guys, and probably wouldn't have hit Diamond Provider to start with if it wasn't for that. We'd have got close and we'd have still done lots of cases, but we needed that extra sort of jump to get to that level as well, which was a great help.
No, it's been a joy.
Thank you.
Yeah, thank you so much.
Thanks a lot.
Please note, the views shared are personal to our guests and not official advice. All treatments carry risks. Consult a qualified health practitioner to determine if a treatment is right for you. For surgical or invasive procedures, seek a second opinion from an appropriately qualified health practitioner. Always consult a licensed health professional for your specific concerns. Enjoy the show.